What is biosafe dentistry?
Well, we're talking about different problems that the materials might bring to a dental environment. Most commonly, the mercury. And we're talking about trying to eliminate toxic materials so that the child or the adult does not get a toxic load from the actual materials that we're using to restore the teeth.
Right. Not always necessarily the easiest choice, right, for a dentist to work with, but certainly the safe choice. And by the way, not just for the patient, but also for you, the dentist.
Right. Well, we are using the procedure or protocol that allows us to be safe as well as the dentist and the assistant who is right there chairside removing mercury amalgam, and also for anybody in the office area. So we're trying to be as, quote, safe as possible, not to have other people be exposed to the toxins.
Sure.
You know, it's just to sort of frame the discussion this afternoon a little more. You know, most people are familiar with the world of holistic medicine, or the term holistic medicine. In my opinion, what's been overlooked the greatest in the field of medicine is holistic dentistry. People don't even know, in a lot of cases, that there are choices for this approach. So we have to go back to the very beginning, that whatever goes in the mouth goes into the body. And if we start at that principle, we can start treating children appropriately, safely, and ensuring that they won't have any repercussions further down the road from any toxic dental materials placed in their mouth.
Absolutely.
So this is why it's such an important discussion. I think people are not aware of this as much as they should be. And I'm kind of curious, Dr. Moran, how you even entered into this territory.
Yeah, so I graduated, from traditional dental school, like we all do, and practiced traditionally in the beginning, and just noticed that the same patients were coming back with problems. Drill fills 6 months later, drill fill again, and we weren't actually seeing big changes. So I started researching more into the root causes of why is this happening? What's going on with them? And then I was pregnant with my son, who's actually turning 13 next week. So It's been a while now.
Happy birthday.
Yeah, and that's what made me really start researching the materials of what it was. I didn't want to be around anything during that time. I wanted to protect him, and I started thinking, how have I not thought about this before, about protecting my patients more, and really looking into how can I protect them in the best way and make sure that they're okay.
Yeah. That's amazing. So kudos. It reminds me, Dr. Murray, you've heard of this before at the clinical practice level in natural medicine, that one of the best ways to detox, as scary and as horrible as this sounds, one of the best ways to detoxify the human female body is to have them get pregnant. Because that's where all of the heavy metals, toxins, furans, BPA, and everything else dumps, is into the fetus, as sad as that sounds. And it's not the process that we advise. It's like get clean before I bring this in. But I just wanted to suggest that the other thing this reminds me of is, as medical practitioners of the dental surgery art and science form, you swear a Hippocratic oath as well, and that's first to do no harm. Right. And I think one of the best ways to do that is sometimes is to avoid putting these harmful materials into another human body in the first place. And so that's biosafe dentistry. What does holistic dentistry mean to you?
So for me, holistic dentistry is, instead of just looking at the teeth and the mouth, but we're trying to think, how can we help this child be as healthy as possible? We start our initial appointments with nutritional counseling. We really focus on airway now, which I think is a huge part of holistic dentistry. We want to make sure that that child is set up to get oxygen into their brain when they're sleeping and not have anything obstructive. And if we can change them when they're young, like little tiny babies, just breastfeeding, tongue tie releases, working on oral function, we can set them up for life. I see kids that, I go over nutrition with parents and they eat amazing, but they still get cavities. And that's typically airway related, that they're getting those issues. We're also focusing on the microbiome, and we look at like acidity inside the mouth. We have testing of saliva to see exactly what's in there, how we can help them. And then obviously if the gut's off, the mouth is off. So we
Right.
definitely want to think about that.
Absolutely. Dr. Yokoyama, when did you start in clinical practice in the BioSafe community?
Well, Murray said 40 years, but I've been a holistic dentist maybe 20 years. I started out the same thing. I went to USC. My father went to USC as a dentist. So I was very well seeped in the conventional, traditional dentistry. In fact, I practiced dentistry for 10 years and then became a hospital dentist. And when I got to be able to talk with physicians and I had to interact with anesthesiologists and be able to look at the medical side of what I was doing, I started to realize there is a difference between just doing conventional dentistry
Drill
and
and fill.
also looking at the entire biosystem and saying, well, whatever I'm doing, I want to be compatible. I want to be part of the health system. I want to be bringing health to the patient, not just health to the teeth or the gums. And that started me off thinking about how to bring medicine and dentistry a little closer together.
Amazing.
That's great.